COVID-19 asked the doctor। पिछला 1.25 साल पूरी दुनिया पर बहुत भारी रहा है और हम सब ने अपने अपने तौर पर बहुत कुछ झेला है। जहां किसी के लिए लॉकडाउन्स परिवार के साथ वक्त बिताने का बहाना बने, वहीं कईयों के लिए लॉकडाउन ने उनकी जिंदगी को उथल पुथल कर दिया। कोरोना की भी हम सब में से लाखों लोग हम उसके शिकार हुए हैं और हम में से कई लोगों ने अपने किसी करीबी को भी इस बीमारी के चलते हमेशा के लिए खो दिया। अब आज हम एक बहुत ही महत्वपूर्ण मकाम पर है जहां पर इस लड़ाई में हमारा साथ देने के लिए कोरोना से लड़ने के लिए वैक्सीन्स आ गई हैं बाजार में। और 5 से 10 साल जिस चीज को बनने में लगते हैं, पूरी दुनिया के साइंटिस्ट और डॉक्टर्स ने उसे कुछ महीनों में हमारे लिए तैयार किया है। पर इन वैक्सीन्स के होने के बावजूद भी आज भी हम में से कई लोगों के मन में वैक्सीन्स को लेकर बहुत शंकाएं हैं, बहुत सारे मिथ्स हैं, बहुत आशंकाएं हैं, डर है, काफी कंफ्यूजन रहता है। और आज जब केसेस काफी कम हो रहे हैं, पोस्ट कोविड केयर को लेकर भी काफी लोगों में कंफ्यूजन रहता है। तो शुगर मीडियाज में हमने सोचा कि हमारी जो वॉइस इंडस्ट्री है, वॉइस ओवर आर्टिस्ट की जो हमारी फैमिली है, उनके लिए क्यों ना एक सेशन किया जाए जहां पर एक प्रसिद्ध डॉक्टर को इन्वाइट किया जाए और उनसे पूछा जाए, उनसे हमारे सारे सवालों के आंसर्स लिए जाएं, का हल लिया जाए। तो इसीलिए हमने आज का ये सेशन ऑर्गेनाइज किया है, COVID-19 Ask the Doctor, an interactive session on vaccine facts, myths and COVID care. कई सवाल होते हैं। What symptoms should one watch out for? Which vaccine is better? When to seek medical help? And there's so many questions, such a lot of clutter. And to declutter our mind, we are indeed very privileged to have with us leading physician, cardiologist and diabetologist, Dr. Abhishek Bhargav, who will guide us through this maze of questions and give us the much needed clarity in this topic. Dr. Bhargav is a graduate from Grant Medical College and Sir J.J. Group of Hospitals and has subsequently done his D&B medicine. He was recently awarded the prestigious FEAC fellowship. He was formerly attached with Bombay Hospital and Asian Heart Hospital, and he is currently practicing as a physician, cardiologist and diabetologist, and is attached with Hinduja Healthcare, Seven Hills Hospital, BSCS, Criticare, Arogyinidhi and Sujoy Hospital. He is also the recipient of the prestigious Rashtriya Gaurav Award for Medical Excellence in 2012. He has presented various papers at national and international conferences, and he also has many publications to his name. It gives me immense delight and happiness in inviting Dr. Abhishek Bhargav. Dr. Bhargav, good evening, welcome and thank you for your time.
Good evening, Darpan. Thank you for the warm introduction and a very, very warm welcome to all friends and colleagues and everyone who's joined in for listening to this discussion. So today we've gathered here to talk about COVID-19, the vaccine specifically, and every other question associated with COVID-19. We'll try keeping this interactive. I would go through a short presentation in the beginning just to give you a brief idea of the various vaccines and how things are going about, with a very, very little touch up on COVID-19 in terms of symptoms. And we'll also talk about the various myths associated with vaccinations. And following that, I would be happy to interact with the entire audience about their questions and answers, their thoughts, their doubts, which I'll be happy to clear off.
That'll be great, Doctor. Thank you so much. I hand over the screen to you now. Thank you, Doctor.
Thank you. So good evening, everyone. We're going to be basically talking about COVID with special focus on the vaccines and how vaccines can help us achieve a healthy India back again. So what is COVID? What is it that we're talking about? Now, coronavirus first emerged in the Wuhan province of China in December 2019, leading to the worst ever pandemic that the world has ever known. And the disease eventually is called, of course, COVID-19. The virus is officially designated as SARS-CoV-2, and the reason I'm mentioning that it is designated as SARS-CoV-2 because quite often when you see your your COVID test reports, it mentions SARS-CoV-2 positive or negative. So when it is positive, it basically means you have the virus. When it's negative, it has not detected the virus. A negative report does not necessarily mean you do not have the virus, but a positive report is obviously 100% confirmatory. Now, typical signs and symptoms that an individual may suffer from COVID is fever, headache, cough, which is dry cough to begin with, muscle pains, tiredness, and at times shortness of breath. As the disease progresses, the shortness of breath increases, and finally you may have decrease in oxygen levels, which is why we keep checking the oxygen levels on the pulse oximeter. One may also experience diarrheas, and this is just a cross-section of the lungs and the tracheobronchial tree, as to just to give you an idea how the virus proliferates and replicates in the respiratory lining. So once you are infected with the virus, it lodges into the airways and the alveoli and multiplies itself, forming corona factories that keep spewing out a huge number of new viruses that go on to infect others, which is why once you are infected, your near and dear ones also land up getting infected because of these corona factories in the lungs. God forbid, if the individual is down with a severe viral load and his own immunity is low, or God forbid, he suffers from a severe illness, he or she could land up being on the ventilator, wherein extensive lung damage has already taken place. You must be aware of the CT scans that are frequently done, and quite often people judge it based on the scores. On a CT score, which ranges from 0 to 25, higher the score, worse is your illness. So the question everyone has in mind is, when will this outbreak end and when will we be back to a normal life? Everyone is longing. I mean, I long for this old life every day, but well, we are still far from it for the moment. It could take a year, could take a couple of years. Time will tell us. It is clear that the current strategy, of course, of shutting down the large parts of the society is, of course, these lockdowns are not sustainable in the long term. And we will finally have to devise a strategy where we could avoid these lockdowns. So the COVID-19 pandemic, of course, has disrupted lives for more than a year, and vaccination, fortunately, is the only way out of it. And countries which have undergone extensive vaccinations, such as Israel, are hardly reporting any cases. The United States has undergone 50% vaccinations till now for all its adult population. And already the CDC guidelines are that vaccinated people can remove their mask and roam outdoors. Hopefully one day even we in India will see that day, but for the moment there is time for it. So what is a vaccine? Now, vaccine is basically designed to prevent diseases. Vaccine contains the same germs that cause diseases, but there is a slight difference. They are either killed or weakened to the point that they do not make us sick, and some vaccines contain only a part of the disease germ. Vaccines stimulate immune system to respond and produce antibodies like it would be had we been exposed to the virus. After getting vaccinated, we would develop immunity to that disease without having to get the disease itself. So how long does it normally take to develop a vaccine? Now, typically it takes years. 10 to 15 years is an average. At times it takes much longer. However, given the extent of this pandemic, vaccines have been developed in a safe and responsible way much, much faster because of close collaboration between the regulatory and the healthcare authorities and the scientists world over, who have compressed stages which would normally take years into months, and those that would have taken months into years. And I'll just briefly show you. On the above section, you would see that initial designing a vaccine takes about years of research, years of preclinical studies, and then toxicology studies. And finally, you go on to the clinical trials, which has phase 1, phase 2, phase 3. All these phase 3, phases would easily take 5 to 7 years as far as all conventional vaccines have been studied. Malaria vaccines, dengue vaccines, HIV vaccines are still under study. And then subsequently, once those trials have been successful, the data gets submitted to the healthcare authorities, whom they themselves take about 1 to 2 years before approvals, and then large-scale production takes place, typically 15 years or longer. Now, what has been different with the COVID vaccines? Now, the preclinical data that has been used as far as whatever data we had on the SARS-CoV-1, that was the SARS epidemic in 2002, which began in China again, and then the Middle Eastern coronavirus epidemic that was happened in the Middle Eastern countries. Now, based on that data, the vaccines were designed. Based on the mice studies, the vaccines were designed, and they've undergone rapid phase 1, phase 2, phase 3 trials, which have lasted about 5 to 7 months. And subsequently, the data has been submitted to the healthcare authorities. And what would have taken 15 years longer has been completed in less than 1.5 years. So this itself is a big achievement. So this may bring you to the question that, have they been extensively studied? Are they safe? They've been produced this fast. Is it safe in taking them? Yes, vaccines have undergone extensive testing to make sure that they are safe and effective. Once a vaccine is licensed, that is not where the job ends as far as regulatory authorities are concerned, and they continue monitoring and investigating for potential safety concerns. So another question that people have in mind is that we've taken the 2 jabs, we've taken the COVID-19 shot. Now what? Do we have to take a 3rd shot? Do we have to take a booster? What's going to happen? Well, time will tell. For the moment, these vaccines have been in the market for about 6 months, and clinical data for the moment is showing that at least these vaccines are good for 6 months, probably for a year. It may be longer. Time will tell us. Now, some vaccines like polio vaccines, which you remember you have taken during your childhood or you've given your children, regular polio camps keep happening, and immunity conferred by the polio vaccines and vaccines similar to that is lifetime. However, as against if you are suffering from respiratory disorders, and if you are aware of flu shots are very mandatory in the West. In India, the trend is gradually catching up. These flu shots are an annual shot. So every year you have to take the flu shot because the virus keeps changing. So whether COVID-19 vaccines will become an annual feature or not, only time will tell us. Coming to the specific vaccines that have been currently approved in India, it's the Covishield, Covaxin, and the Sputnik 5 or the Russian vaccine. So Covishield is being manufactured in India under collaboration with AstraZeneca by Serum Institute of India. Now, Serum Institute of India is the world's largest vaccine manufacturer, and India is often known as the vaccine producer of the world, purely because of the robust facilities and the robust production by Serum Institute of India. Covaxin has been produced by the Bharat Biotech, and Sputnik 5, of course, is being right now produced by Dr. Reddy in close collaboration with the Gamaleya Institute in Russia, which has produced the Sputnik 5 vaccine. Talking individually about vaccines, as far as Covishield is concerned, the Oxford AstraZeneca vaccine, as I mentioned, is being manufactured by Serum Institute of India in India, and it's given the name Covishield. Outside, it's known as the AstraZeneca vaccine or the ChAdOx1 vaccine. It has been modified to look more like the coronavirus, although it can't cause illness. The vaccine is made from a weakened version of an adenovirus from the chimpanzees. The jab is administered in 2 doses, given every 4 to 12 weeks. That is 2 doses. The in clinical trials, it was given at 4 weeks. Then there was a study which said that if you could extend the duration of vaccine, the efficacy would have been better. And as per current Government of India guidelines, it is at least 84 days apart. So the vaccine, of course, can be safely transported at between 2 to 8 degrees Celsius temperatures. Covaxin is in fact a whole virus vaccine. It's an inactivated vaccine, which means that it's made up of killed coronaviruses, making it safe to be injected into the body. Bharat Biotech uses a sample of coronavirus, which was isolated by the NIV Institute, that is the National Institute of Virology, Pune. When administered, immune cells recognize the death virus, prompting the immune system to make antibodies against the pandemic virus. 2 doses here are given 4 weeks apart at 28 days interval, and the vaccine again can be stored easily between 2 degrees to 8 degrees. The Sputnik 5. The Sputnik 5 vaccines, which should be launching in India by 10th of June. Russia's Sputnik vaccine has been deemed to be safe and works in the same manner in which the Oxford AstraZeneca vaccine works. It can be stored. There is a little bit of variation in terms of storage. The liquid form, which is going to be available, requires 18 degrees Celsius for storage, and the powder form, which is going to be coming out shortly, requires 2 to 8 degrees Celsius. Sputnik 5 has been approved in 60 countries, including Argentina, Palestine territories, Venezuela, Hungary, UAE. The difference between the 2 jabs of the Sputnik vaccine is that both these vaccine shots are slightly different versions of the vaccine, and they're given at an interval of 21 days apart. They both target the coronavirus distinct spike protein, but use different vectors, the neutralizing virus that carries the spike to the body. The idea here is to use 2 different formulas to boost the immune system even more than the same version twice. And this will land up giving a more longer lasting protection. If you want to know the various vaccine candidates in India, the 3 that are currently available, the Covishield, Covaxin, Sputnik 5. Kerala is likely to submit its vaccine details in June, that is next month, for DGCA for inspection. You also have the protein vaccine, the Novavax, being studied by the Serum Institute of Pune. You have the recombinant protein antigen-based vaccine being produced by Biological Institute Hyderabad in collaboration with MIT USA. India is also coming up with its own mRNA-based vaccine like the Pfizer and Moderna vaccines being developed by Genova Pune. Then there is an inactivated rabies vector virus vaccine again by Bharat Biotech, and a vesicular vax platform vaccine being developed by Aurobindo Pharma in collaboration with Oro Vaccines USA. Of the various vaccines currently available in the world, right on the top, you have the Pfizer and the Moderna vaccines, which are mRNA-based vaccines. The only issue with these vaccines is transportation, where they require as much as minus 80 degrees as far as Pfizer is concerned for storage, and Moderna requires about minus 25 degrees for storage. Then the Oxford AstraZeneca vaccines, which is the Covishield vaccines here in India. You have 2 shots to be given. Storage is 2 to 8 degrees. Sputnik 5 again requires two shots. Storage, as I mentioned, liquid form is 18 degrees. Dry form is 2 to 8 degrees. Johnson & Johnson is the only current vaccine available, which requires only 1 shot, and it is stored between 2 to 8 degrees Celsius. You have 2 Chinese vaccines which are currently approved by the WHO, the CoronaVac, that's the Sinovac, and the Sinopharm vaccines. Both are inactivated virus vaccines, very similar to the Covaxin, requiring storage of 2 to 8 degrees. The Covaxin, again, 2 shots, inactivated virus, requiring storage of 2 to 8 degrees. And the protein-based vaccine, Novavax, which is soon to be coming out, again requires 2 shots at 2 to 8 degrees. Now, all these vaccines that you have in front of your eyes, there are only 5 vaccines which are currently approved by the WHO. That's the Pfizer, Moderna, the Covishield or the Oxford AstraZeneca vaccine, and the 2 Chinese vaccines, the CoronaVac and the Sinopharm. So these are the only vaccines which are currently approved by WHO to be recognized as vaccinated persons for international travel. The rest, of course, will take some time for recognition. Coming to the various myths associated with the vaccines, the most common, COVID-19 vaccines are not safe at all because they were developed so quickly. Well, the reality is these vaccines are safe and have been approved by regulatory health authorities all over the world. Millions by now have been vaccinated. Reports of serious side effects have been very rare and no long-term complications have been reported so far. So in general, it is extremely safe. So can one get COVID-19 from the vaccines? Quite often you say, you've heard of stories, XYZ went in for the COVID vaccine, 2 days later he's developed COVID. So was the vaccine responsible? Absolutely no. The vaccine cannot cause COVID because for COVID-19 to happen, you have to be injected with a live virus. All vaccines do not have live virus. They are either dead or inactivated. So none of the currently authorized COVID-19 vaccines contain live replicating virus, and therefore one cannot get COVID-19 by being vaccinated. So individuals who got COVID after the vaccination were individuals who are already harboring the virus or probably picked it up because of either drop of masks or because of being in crowded surroundings. Another myth, very common, I have already had COVID-19, so I don't need to be vaccinated. Well, after the first wave, a lot of people felt that way. But, to your surprise, after the second wave, as soon as someone is diagnosed of COVID, the first shot they ask the doctor is, when can I take my vaccine? How soon can I take my vaccine? Such is now the trauma caused by COVID. So people who have had COVID-19 infection, of course, need to be vaccinated. The current recommendation by the Government of India guidelines is 3 months post-COVID. That is because you already have antibodies, and that's the time you will take to recover completely so that you can be injected with the vaccine. But definitely all should be vaccinated, even if you've had COVID in the past. So the fatality rate, again, another question which was definitely during the first wave. And a lot of people asked about this, that, doc, the fatality rate of COVID-19 is so low. So I don't think you need to be vaccinated. And this was being asked by very educated people also. Max, 14 days is what I have to be at home. Mortality is less than 1%, 1.5%. My chances of dying is extremely poor. However, the second wave has changed all their thoughts now, because younger individuals have died, mortality has been huge, a lot of people have died. The second wave has been terrifying, absolutely terrifying, and the morbidity, even in those who have recovered, has been extremely high. So vaccination is important, even though most people infected with COVID-19 do not die. Vaccination protects yourself, your family, colleagues, and your community. And finally, if we want to get back to our old life, we all will have to get vaccinated. One thing is for sure that, there are cases of COVID-19 after vaccination also. It is not that the vaccines will, because you've been vaccinated, you will not get COVID-19. You can get COVID-19. But what you can be assured of is that you will not land up on the ventilator. Your chances of death are negligible if you've been vaccinated. So there is no need of mask wearing and social distancing after receiving COVID-19 vaccination. Well, in reality, this may be true one day, but not now, because we are still battling with the second wave. While vaccines are effective, they do not stop every case of COVID-19 infection and transmission. Therefore, everyone must remain cautious and for now continue to wear masks, practice social distancing, and observe enhanced hygiene routines. So people with underlying conditions should not be vaccinated. Well, majority of patients with various underlying conditions can still be vaccinated. There is a very, very small proportion who cannot be vaccinated, and that is very, very small. So every individual who may be suffering from various comorbidities should speak to their doctor. And at times there could be modification medication that need to be done, specifically individuals who are on specific kinds of blood thinners. But vaccination is something that can be taken with modifications if needed. Another myth, so the COVID-19 vaccines are not effective against the new variants. Well, the answer to this is that currently there have been 4 variants of concern in the world. One is the Brazilian variant, the South African variant, the UK or the Kent variant, and finally the fourth, or known as the Indian variant. Now, as far as vaccines are concerned, all of them have been found to be effective. As far as the UK and the Brazilian variant is concerned, the Covishield was found to be less effective against the South African variant in terms of protecting you from mild to moderate illness, but was 100% protective against severe illnesses. If you look at the Indian variant, a single shot of Pfizer and this was a study that was last week published in the UK, which compared single shots of Pfizer vaccines and AstraZeneca vaccines or the Covishield vaccines uh, on the Indian strain, and they found that the single dose protected you against only 33%, which is hardly any protection. And with two doses, the protection went up both with Pfizer and the Covishield vaccines, and they were similar in protecting about 66%. So definitely they work on variants. Of course, these vaccines were designed against the original coronavirus, which has now been replaced in majority of cases by the variant. Though the protection is still there, may not be as optimal as it was against the original virus, but they will still protect you 66%. Another very common thing is, no doc, I don't want fever, headache, body ache. Some people have died, some people have this, and you have various WhatsApp messages going in. The latest one trending in is that after 2 years, all those who've taken COVID-19 vaccine are going to die. Of course, there is no truth in all this. So severe side effects of COVID-19 vaccines are very, very common. In reality, the side effects are fairly mild. I mean, the most common side effects associated are pain, heaviness, soreness of the arm, may be associated with fever, which will last for about 12 to 24 hours. Some people have reported an occasional cough, but all this normally settles down in 48 hours max in a week. Anything that lasts beyond that should require further evaluation. Things that you must remember before vaccination is that in case you have any allergies to medications, drugs, get a clearance from your regular doctor, eat well, and take medications as prescribed ahead of vaccination. Be as relaxed as possible because stress will also increase your incidence of side effects. Monitor your diabetes and blood sugar and keep them under check. Cancer patients, especially those on chemotherapy, will need to act on medical advice. And people who've received blood plasma monoclonal antibodies as part of the COVID-19 treatment, or those who've been infected in the last 3 months, ideally should not take the vaccine immediately. After vaccination, the recipient of the vaccine is monitored at the vaccine center for 30 minutes and is allowed to go home only if there is no immediate adverse reaction. Side effects like pain at the injection site and fever are fairly common. There's no need to panic. A simple paracetamol helps you out. And some other side effects like chills and fatigue may also be expected, but they will go away in a few days. Important points to note is it typically takes a few weeks after vaccination for the body to build protection against the virus. So do not throw off your mask celebrating that you've been vaccinated today and tomorrow you'll be protected. That is not going to happen. Antibodies will form only 3 weeks after your first dose, and that also is in small amounts. Your actual protection starts 15 days after your second dose. This means that the person could still get infected by COVID-19 in the few days immediately following the vaccination because the person would not have had enough time to develop immunity. Therefore, basic precautionary measures must be followed even after vaccination. Face masks, hand hygiene, and physical distancing in public places must not be abandoned just because a vaccine has been taken. Cough, sneeze etiquettes also need to be followed. Another thing to remember is that, of course, the vaccination now open to all adults above the age of 18. It is not possible for a vaccinated person to donate blood for at least 60 days after the first jab. This is as per the current recommendations. This, of course, did create a crisis in terms of blood, because we face shortage of blood in the various blood banks. So if you're looking at blood donation, donate it first and then take the vaccine. Thank you. In fact, I would now open this to the audience for various questions.
Sure. Thank you, Dr. Bhargav. That was very insightful, very informative. In fact, I would like to believe that you have already, covered so many. It's more like a preemptive presentation where, in fact, you are in tune with even the most latest, WhatsApp University message, which says that in 2-3 years everyone will die, which I think is the most latest one, if I'm not wrong.
Yeah, that's the latest crappiest message that one can come across.
Absolutely. Dr. Bhargav, tell me one thing, what is worse right now? Is it vaccine shortage is worse or vaccine hesitancy is worse? Because I can see around me, not just, sometimes we say that people in the rural areas are more hesitant, but I see people from urban areas, educated people, even today thinking, "Ke nahi, main nahi lunga." Is that a more dangerous situation than vaccine shortage as well?
So when we began with vaccination, the vaccine hesitancy was very high. It was very, very high. And as the healthcare workers, even in the hospitals, the first vaccination started with the hospitals, with healthcare workers. And unless and until the doctors had not taken the vaccine, the nursing staff and the ward boys and the junior staff would not take it. Even the resident doctors would not take it because the consultants had not taken it. So as people started taking it, and they realized that side effects were only for a day or two, and then you were back to work, everything was hunky-dory. People gradually in healthcare settings started taking it. Once the healthcare settings started taking it, they then came the frontline workers. They had already seen that the healthcare workers have taken it and they are fairly safe. And then the frontline workers gradually kept taking place. Now, because before the second wave had hit in, the hesitancy was quite high. And at that point of time, unfortunately, there was no shortage of vaccines. So at that point of time, if you look at the seesaw, the scale was more tilted towards vaccine hesitancy. But then came the second wave, and then it changed everything. The vaccines also went into shortage. And currently, the vaccine hesitancy is going down every day. And people are desperate to take vaccines. And unfortunately, it has been combined with a shortage, which hopefully in the next 10-15 days will start coming down, because fresh stock of vaccines is arriving. Of course, Sputnik 5 is also arriving. Hopefully, we would have Pfizer vaccines coming in July. Moderna will come in later on. And hopefully, the vaccines which are currently approved only for above the age of 18 will soon start getting approved for 12 and above, specifically the Pfizer, which is currently approved world over for 12 and above. Moderna is getting approved for 12 and above. So eventually we'll have a plethora of vaccines. And today you may be chasing the vaccine, but give it 2 months down the line, by August, vaccines will chase you.
Absolutely, like it is in the US right now. Dr. Bhargav, do you think the US case study is also a reference point for us, where more than half the adult population has been vaccinated, and the CDC guidelines do not require you to even wear masks? So is that a point of great encouragement for us in India that vaccine is safe?
No, absolutely. So, with the CDC opening up, and CDC is one of the most stringent bodies world over. Medical literature and everything, whichever part of the world you are living in, you have the DGC in India, you have the EMA, which is again a very powerful association in Europe. You have the NICE in UK, but all of them look up to the CDC. All international guidelines are framed based on CDC recommendations. So as far as CDC is concerned, and when CDC is saying that unvaccinated can open up, it's definitely based on scientific literature, and that is the advantage of getting vaccinated. So if everyone gets vaccinated, we open up everything, we're back to our olden days.
Yeah, I hope this goes out loud and clear that please get vaccinated. Hamari voice industry maybe, Dr. Bhargav, I'm seeing there is a lot of abhi tak, even people above 45. I know many people who are still waiting. So I think, it's important to put this out, that this way you are not becoming a part of the solution. In fact, you're only adding to the problem. If 700-800 million people all over the world have taken the vaccine, what more reason do you want to have? So yeah, that's an important information.
Absolutely. Absolutely. So, I mean, as long as people take the vaccines, I mean, and if everyone succeeds in taking it, we require 70%. So, if 70% takes it, we have herd immunity. We out of this.
Absolutely. That sounds very reassuring. Dr. Bhargav, ek baat bataiye. Now, even today, as I'm talking to you, I've got messages on my phone. One question which I'm sure you get every day, and I'm sure you're so tired of it. और अभी तो हमारे पास सिर्फ 2 ही वैक्सीन है. Half the world wants to take Covishield and the other half wants to take Covaxin. So, और अब तो Sputnik 5 आ रही है. So, how is it going problem of a plenty, or people, in terms of not being able to take a decision, they will procrastinate?
So, you see, world over, no one has a choice to select a vaccine. World over. Okay, whether you're looking at the US, you're looking at UK, you're looking at Europe, anywhere in the world, or China, or UAE, or anywhere, okay, where we would normally look up to, there is no choice of vaccination anywhere in the world. Here, of course, Indians always try looking at choices. Unfortunately, when we don't have any choices, whatever vaccine is being offered, you have to take it. Both Covaxin and Covishield have virtually equivalent efficacy. There may be variations in efficacy if you look at Sputnik 5 or the Pfizer in terms of mild to moderate cases. Again, these were separately studied in different clinical trials in different settings with different people with different variants. It is not that there has been any vaccine which has been studied head-to-head. There have been head-to-head trials in the UK between the Pfizer and the AstraZeneca over the variants. And it has been found that both the Pfizer and the AstraZeneca were equivocal. AstraZeneca is the Covishield vaccine. So both were equivocal. So whichever vaccine you get, please take it. Okay. There is hardly any benefit in waiting and contracting COVID before. And then again, your vaccination gets pushed up by 3 months.
Sure.
So whichever vaccine you get, you take it. All vaccines are equally safe. They're equally protective. Now, if you're looking at international travel, as of current date, only Covishield is approved by the WHO.
That was my next question.
Yeah. So Covaxin will get approval probably after August, September. But exactly, we do not know when the approval happens. The Sputnik 5 still has to submit papers for international recognition, for WHO recognition. So, I mean, those Sputnik 5 may be a very attractive option, but I mean, for international travel, you will still be regarded as an unvaccinated individual.
So that automatically puts Covishield at an edge for people who are looking at international travel.
People who are looking at international travel, Covishield.
Yeah, which brings me to my next question, Dr. Bhargav, which is about students who are going abroad. As you may be aware that just yesterday, the BMC took a decision about allowing them to, yeah, but Dr. Bhargav, most of these students who are going to the US or Canada are going in August. So if they take the first shot now, their next shot gets due in the end of August or September. So, how do you think would it work? Would you think that they would relook at this 12-week rule for them?
Let me come to this. And this is a good question. Now, you see the original guidelines for 4 to 6 weeks, which went up to 6 to 8 weeks, and which has now been increased to 12 weeks. Now, the current pandemic that is happening right now is because of the Indian variant. There is no doubt about that. If you look at data which came in last Sunday from the UK, with the one single dose, the efficacy was only 33% after the Covishield vaccine, including the Pfizer vaccine. And if you took the 2 doses at 4 weeks of intervals, the efficacy was about 66%. Now, based on this data, the UK government reduced the vaccination, and the Indian variant is now probably going to soon become the dominant variant in the UK. The guideline was changed from 12 weeks to 4 to 6 weeks. As far as students are concerned, if you look at the recent announcement by the state of Kerala, the Kerala government has issued a notification that students who are traveling abroad need to submit their passport and their traveling documentations and take the vaccines between 4 to 6 weeks, so that their travel is not hindered. Probably similarly, other states may follow same. And once you have the availability of vaccines, probably that guideline will come down and it will probably be left up to the public that you can take it anytime after 4 weeks.
So it's going to be very dynamic in that
It
sense.
It is.
We will have to live on that hope that things will only.
If Kerala in India has changed it, so if Kerala has changed it, other states will also follow. The problem is the same. The world, pan India.
Of course, Doctor, do you think the worst is behind us?
As far as the second wave is concerned, yes.
Okay.
Let's hope we vaccinate successfully so that we can avoid a third wave.
Absolutely. Doctor, we have some questions. Sumit Pasricha says, if husband had COVID and wife didn't get tested positive at the same time, but a month later, antibody test shows for 52 plus, should wife go for the vaccination or wait for some period to get her first jab?
So wife also developed COVID, but this COVID was asymptomatic. The very fact that she's developed antibodies. You will develop antibodies only if you've had exposure to the virus. Otherwise, you will not develop antibodies. Okay. So she probably had an asymptomatic or mild COVID, which she probably did not realize. So this is of course a fresh COVID infection, and she also falls into the same category of 3 months post COVID.
So she should wait for 3 months before getting the vaccine. Right?
So she and her husband should take together at 3 months.
Okay. So Sumit Pasricha, if you're watching, so you've got your answer. What is NRBM? An 83-year-old gentleman is on 10 to 15 liters of oxygen. How do you read this?
So NRBM is a nasal rebreathing mask, wherein it comes in with a reservoir bag. So if you looked at oxygen, typically you would have seen two kinds of oxygens. I mean, one is the simple nasal prong, which just goes into the nostril, that you've seen in the movies. Since you all are voiceover artists, so you all must be aware of this. And then people who've been shown very, very sick have a mask, and oxygen is being attached. So that is a normal mask, and NRBM is a modification of the normal mask, wherein with this regular mask there's a reservoir bag. So the reservoir bag, the way it helps is that you tend to breathe in a much higher percentage of oxygen into yourself, rather than when you're breathing just oxygen through the nasal prongs or the regular mask.
Okay.
So NRBM helps in achieving higher oxygen status as compared to regular masks.
Okay. So that's, I hope that addresses the question. Would you advise vaccination of two different? This is a question that I'm seeing a lot of two different companies. एक shot कोविशील्ड का जुलाई में अगर फाइजर आ जाता है तो एक शॉट फाइजर का. You think, doctor, this will a cocktail आगे जाके will it become?
So you see, a cocktail is being done in Europe. Okay, there was a trial also which studied the cocktails. Now, of course, it was found that your risk of side effects is slightly higher if you're using a cocktail regimen than a non-cocktail regimen. But in the UK, a lot of people have been given cocktail shots. People are, under the age of 30 have now been, if they've received a first shot of AstraZeneca, they're given the second shot of Pfizer. In Europe, with various countries, various guidelines, above 55, above 60, below 45, various individuals have received cocktails. So cocktails have been given. Now, how they would benefit in the long run or will be harmful in the long run, we do not know for this certain moment, but it has been done. Even in India, in UP, 12 people were given two different set of viruses. Of course, not viruses, sorry, vaccines. It was accidental, but it happened. All of them are fine. So it may be a choice that may come in later on. In fact, there's a clinical trial going in with the first dose of Covishield and the second dose of Sputnik 5 right now. That is currently on.
Okay, so these are very fluid times, and the next 2-3 months, things should really dramatically change in terms of a lot of clarity about these vaccines. So yes. it's more about everyone needs to be very, very careful for the next 2-3 months, especially till availability of these vaccines is not totally sorted.
True.
So one question again. We have some voice artists had asked that should one get a test done, a pre-vaccine test done? This is a question that I see a lot. People are quite hesitant. कोई कहता है कि आपको CRP कराना ही चाहिए टेस्ट वैक्सीन लेने के पहले. How valid is that?
ये सब टेस्ट इंडिया में छोड़कर और कहीं नहीं हो रहे हैं.
अच्छा.
इंडिया में छोड़कर और कहीं नहीं हो रहे हैं प्री वैक्सीन टेस्ट. It has not been done in any clinical trial. It has not been recommended. There is no recommendation anywhere in the world to check for a CRP or a D-dimer before vaccine. It's not recommended. There is no guidance.
There is so much. There is such a lot of chatter in people in WhatsApp groups कि अगर आपकी उम्र 50 के ऊपर है तो पहले सारे टेस्ट कराओ फिर ही वैक्सीन लो. So it is such an insightful comment from your side कि this is an absolute non-discussion point.
कहीं भी एडवाइस नहीं किए गए टेस्ट.
But डॉक्टर भार्गव एक और है कि किसी को सल्फर का एलर्जी हो या फिर बहुत ज्यादा डायबिटीज हो या एस्थमा हो तो क्या उनको वैक्सीन लेने में कोई हिचकिचाहट होनी चाहिए?
तो वैक्सीन में सल्फर नहीं है तो एलर्जी का सवाल ही नहीं उठता सल्फर से, क्योंकि वैक्सीन सल्फर की एलर्जी तभी होगी जब आप कोई सल्फर ड्रग लोगे या सल्फर चीज लोगे. तो वैक्सीन में सल्फर तो है नहीं, तो आप ले सकते हो. As far as asthmatics are concerned, they can take the vaccine. In fact, asthmatics are strongly recommended to take the vaccine. They should be receiving the pneumococcal shots, flu shots, and the COVID-19 shots. Never it has been debated whether an asthmatic should or should not be taking a flu shot or a pneumococcal or a Prevnar shot. So I don't know why debate happens on the COVID-19 vaccine. Absolutely, they should be taking it.
Yeah, I think the reason, I mean, sometimes too much information or too much unverified information which rotates on WhatsApp. Like they say, the WhatsApp university sometimes causes more harm than
that is what causes the problem. I mean, never an asthmatic has ever asked in these years of practice that, in fact, they will ask for themselves that, please give us the flu shot. Please, we've heard of a pneumonia vaccine. Can we take this? In fact, all these vaccines these are ideal candidates for the vaccine. If they contract COVID, they will have more harm than any good. So vaccination should absolutely be done.
तो this is an absolute myth क्योंकि इस वजह से कई लोग, I know a couple of people जिनको बहुत high diabetes है और hypertension है और वो बहुत हिचकिचा रहे हैं.
In fact, इनका risk of getting COVID is very high. They should be taking the vaccine. Of course, इसका ये मतलब नहीं कि COVID ये डायबिटीज को आप कंट्रोल नहीं करिए. आप अपने डॉक्टर से मिलिए, कंट्रोल कीजिए, ब्लड प्रेशर कंट्रोल कीजिए और वैक्सीन लीजिए.
Okay, fair. The same person who's asking us about the wife, saying what are the chances of the wife getting COVID in case she has antibodies but not vaccinated for 3 months?
So there was a time after the first wave where we used to presume that you had COVID, you are unlikely to get COVID again.
Okay.
That is no longer true because of the variants present now. So if you've been infected by the original coronavirus, if you get infected by the variant again, you will get COVID again. So it is still possible that she can get COVID, though the likelihood comes down, but it is still possible.
So you can't let your guard down as yet.
No, you can't let your guard down. Absolutely no. Even if you've had COVID, you don't know in today's times whether it was the variant that hit you or the original virus hit you.
Yeah, correct. Absolutely. Dr. Bhargav, one thing about post-COVID, care, क्योंकि अभी of late we are seeing a lot of post-COVID syndrome, जिसको कहते हैं layman language में, कि COVID के बाद किसी की diabetes, sugar बहुत बढ़ गया, COVID के बाद किसी को किसी तरह का side effect हुआ. So is there any recommendation from your side or any advice to help in that?
COVID is known to cause fluctuations in blood pressures and blood sugars either during the illness or post-illness, and this fluctuation could last as much as 3 months. We know of patients who developed diabetes as a result of COVID. There are people whose blood pressure has gone haywire as a result of COVID. People who were on simple tablets are now on high doses of insulin because of COVID. So these are things that can happen. You just need to monitor your sugars and your blood pressure. Things may be labile for 3 months, but after that they settle down.
Okay, perfect. Doctor, last few questions. One is, I have a question about, should one get an antibody test done after one has recovered from COVID? ये बहुत important एक regular question है.
No, so it is very worthwhile to do an antibody test. Typically should be done anytime after 3 weeks, on average after a month of you getting COVID, because that will tell you what is the level of protection you have developed after your COVID illness.
Right.
I mean, there are individuals who hardly develop any antibodies, and those individuals should ideally not be waiting for 3 months to get a COVID vaccine.
Oh,
So So those are individuals who should immediately take the vaccine, because in spite of having COVID, they've hardly developed any antibody.
So is there a median or like a benchmark for the antibody number?
So unfortunately, there is no benchmark for the antibody titer. Unfortunately, all labs follow a different method of antibody titer. So it's an antibody of 50 in one lab, maybe an antibody titer of 75 in another lab, or maybe just 20 in another lab. So antibody titers, unfortunately, are not standardized. But there is no clinical recommendation that what is a good titer, even in clinical trials and off clinical trials. But generally speaking, a titer of more than 50 is regarded as a good titer.
Okay. Above 50 is a decent number in terms of checking whether you have a decent amount of antibodies.
Yeah.
Perfect, sir. Dr. Bhargav, we are more, again, this is a forum primarily for voiceover artists. So as of now, most of the studios are not operational and most people are recording from home. But in times to come, I'm sure the studios will be back and we will be back in the studios facing the microphone. So it's a closed environment. And although many of us would be vaccinated by then, but is there any guidance that you can, help us with for people like us who are recording in isolated, closed environments?
So till the time you don't achieve adequate vaccination, I mean, as far as your office colleagues and your work environment is concerned, recording from home continues to be your best option, safest option.
Because even before the second wave came in, we had studios who put in sanitizers, clean the microphone filter. But I don't know, is that really only cosmetic?
All that may not necessarily protect you from COVID, because ultimately it's an airborne transmission. No?
Yeah.
I mean, if someone around you has it, just because you're holding the mic, you will not get it. But the virus from the other person may land up to your person. And when you're recording, you're obviously not wearing masks and all.
Yeah, there might be another the person in the earlier session. And you enter the same air, you're breathing the same air.
It's a closed environment. So,
right.
I mean, with closed environments, you need to be careful. So, unless, of course, you have adequate vaccination, everyone's being vaccinated, till that time, recording from home is a safer option.
Perfect. Doctor, one last thing, a layman question. We talk about efficacy, like you just mentioned, that there's an efficacy of 60%, 70, 90. We talk about these percentages. But as a layman, what does this mean? Does this mean that, my probability or my chance of getting infected is higher? How do you break this down in layman language?
So in layman language, all vaccines are 100% effective in protecting you from severe COVID and death.
Okay.
All vaccines, whether it is the Johnson & Johnson, whether it is the Chinese vaccines, whether it is the Indian vaccines, whether it is Pfizer, Moderna, or Sputnik, whatever. All vaccines will protect you 100% against death and severe illness. Now, they may be variable in protecting you from mild to moderate COVID. And that is where the variation in figures comes in. So if a vaccine is 66% effective, that means out of 100, 66 will be protected from mild to moderate COVID. The remaining 44 will develop it. 34 will develop it.
Okay. So is 60, 70% a decent?
It's a decent. I mean, when these vaccines were being manufactured, it was presumed that any vaccine who will be able to offer protection of more than 50% is likely to be considered as a safe vaccine for usage. All these vaccines achieve a figure much higher than the 50% mark, benchmark.
Okay, perfect. Great. Great. Dr. Bhargav, this has been such an insightful, informative session. In fact, like I was telling you earlier, the initial presentation, you covered almost most of the questions, and you could not have been more articulate and empathetic in telling people that go out and vaccinate. I hope in whatever little way, in whatever little reach that this video has, or this video will have in the coming days and weeks and months, I hope that people take this sage advice seriously and get vaccinated at the first opportunity. Because I've been telling all and sundry that if you do not get vaccinated, you're only becoming are part of the problem and not helping the solution. So, and you've been so kind, so generous with your time and your advice. From all of us, Sugar Medias and the voice industry, thank you so much, Dr. Abhishek Bhargav, for your time.
Thank you. Thank you for having me.
Thank you. Bye-bye. That was Dr. Abhishek Bhargav, and he was so kind and so articulate. उन्होंने इतने साफ शब्दों में, इतनी सफाई से, इतने बेहतरीन तरीके से हमें बताया कि अगर अब भी आप में से कुछ लोगों के मन में शंका है वैक्सीन को लेकर या अब तक थी, तो मैं उम्मीद करूंगा कि डॉक्टर अभिषेक भार्गव की बातें सुनकर, and he is a very very renowned experienced doctor, तो अगर डॉक्टर की बात नहीं सुनेंगे तो पता नहीं किसकी सुनेंगे. तो मैं तो यही कहूंगा कि हम व्हाट्सएप यूनिवर्सिटी की बातें ना सुने और जो हमारे मेडिकल एक्सपर्ट्स हैं, डॉक्टर्स हैं, इनकी बात सुने. एंड इफ यू हैवंट येट गॉन अहेड, प्लीज, अगर आपको आपकी वैक्सीन मिल रही है, एंड लाइक डॉक्टर भार्गव सेड, the best vaccine is the vaccine that is available. So I hope in the coming days, especially हमारी voice industry, I hope आप में से जो भी लोग देख रहे हैं, प्लीज इस वीडियो को बाद में आप शेयर कीजिएगा चाहें तो, बिकॉज डॉक्टर भार्गव ने सच में बहुत गजब की बातें बताई हैं, वेरी इंफॉर्मेटिव. ही बस्टेड अ लॉट ऑफ मिथ्स जिनको पाल के बैठे हैं हम. बहुत सारी ऐसी मिथ्या बातें हैं और उन्होंने काफी हकीकत से हमें काफी हकीकत हमें बताई. सो आई होप कि आने वाले दिनों में हम सब और हमारे आसपास के लोगों को हम प्रोत्साहित करेंगे कि वैक्सीनेट हो जाए. मैं वैक्सीनेटेड हूँ और मैं उम्मीद करता हूँ कि आप भी वैक्सीनेटेड होंगे, क्योंकि जितनी जल्दी हम वैक्सीनेटेड होंगे उतनी जल्दी we will get our old world back. So this was the interactive Sugar Media's voice industry webinar, COVID-19 Ask the Doctor. I hope this was worth your time. Thank you for your time. And once again, thank you to Dr. Abhishek Bhargav. Till next time, bye-bye. I'll see you soon. Stay safe.